Hi, good evening and good morning for those who are still waking up. Mlamli Mangala, and welcome to my show, Mlamli Mangala. We are live on YouTube, Mlamli Mangala. We are live on Facebook, Mlamli Mangala. I know you guys have been waiting for this talk for quite some time now. We're going to talk about COVID-19 as usual. But we've got our doctor, Dr. Luyanda Bokolo, based in East London, Mdantsane, practice yake, Paya Highway, MD Square. So we're going to talk about a number of things today, and I'll allow Dr. To go through home-based care in terms of the patient here to COVID-19. We have experienced quite a number of deaths. We have experienced quite a number of uncertainty in terms of this COVID-19. So it is time for us to get in knowledge and see how we can look after our beloved ones. Possibly this might be one of the reasons that can actually help us in terms of informing us positive in terms of COVID-19. So we have Dr. BK. I call her Dr. BK. We have Dr. BK on the line, who's going to actually unpack everything. So we welcome you, Doc. Can you just greet Abantu so that Bakbono can?
Thank you so much. Good evening. Please go on Facebook and YouTube. It's good to be here with you.
Thank you, Doc. Thank you. Guys, without any further ado, without wasting your data, without wasting your time, I will allow Doc to take us through the home base. We are just doing home-based care in terms of patient care, a COVID-19 positive. Doc,
all right. Thank you so much, Mlamli. Thank you so much. At this stage, you see, they are tested positive, but they don't have symptoms and they are not sick. So they go home and self-isolate. Now that's what we wanted to talk about today. But now what do we do now? When we now do as a relative or self-isolate, what can you do? Now, in self-isolation, you test positive, you go home and isolate from abantu balapha and from the population, right? Apha what do you do? We normally say stay in your own room, but see no problem that we see a lot of people dying alone. Because nobody comes in to see. Most people are scared to go into the room. They just leave the food, they leave everything, hoping that the person will come out and care of themselves. Now, needs care as well. Nobody has symptoms, but positive to what can you do that has to take care of this person? Same thing, protect yourself as much as you can. With everything that we say use all time. Use your masks, use your gloves, now, on top of that, you remember, this COVID is going to be airborne. It is also going up through droplets. So, now protect. Now, the needs forms of PPS no sebenzi the plastic aprons the overall. But at the time, innovation. Get a plastic bag, for instance, one plastic bag. Oh, yes, you're going to dispose of have a special outfit or only in contact, and then it could change. So at least you protective clothing when as an individual, but you are still caring for your own beloved person, right? We have to book my because we know vitamin D is also assisting us with all this. COVID positive or self-isolate, just tell the people around when they are avoid touching the doors, avoid touching the walls when you're on your way out. You can stay outside for some time. Remember, you can have minimum contact, always say less than 10 minutes with other people, but I was isolated. Remember, where your neighbors we try to avoid depression associated with that. So how separated from the rest of the people doesn't mean you need to be isolated from the world, right? Communicate, use the mode of phones zakho ngazwendlini, thetha ukwazi awuthi nabanye abantu uncokole ungabi wedwa ube ne-depression uhlale wedwa phaa. But communicate nendlela uzawuphuma ngayo, lo muntu uzawuncedisa makabe nendlela azawusiprotecta ngayo. So uhleli tested positive. What can I take to prevent this disease from going further? What else can I do to support myself to boost my immune system? Okay, you can have your multivitamin. At the same time, you're using vitamin C. 1 gram of vitamin C every day is sufficient. Your zinc tablet, 200 milligrams a day to 400 milligrams. If vitamin D3 4,000 units, it's sufficient. Then, as they are going to be symptomatic. We have a cough mixture. You have a sore throat, you have something to soothe that throat. So basically, the baseline now is going to be those multivitamins. Then everything else is going to protect. But now, this is about the she has gained treatment. When should I say now it's time for me to get up and go to the hospital? So you need to have these few things that you need to watch out for. Shortness of breath, number 1. You notice I'm getting shortness of breath of all those. What can cause shortness of breath? Pneumonia, for one. Pneumonia is an infection of the lung. After pneumonia, you cough. You had a dry cough, throat. You're going to have a productive cough. You're going to feel tired, chest pain, and all that. So at that point in time, you need to go to hospital. Abanye will develop problems where they have difficulty in breathing when they're taking steps, that is dyspnea and exertion, then you need to go to hospital. It's not only pneumonia again that we see. Remember, pneumonia is an infection of the lung. We also see now a rising number in pulmonary embolus. That can also present as a shortness of breath. So when you get to that stage, don't stay at home and be comforted and say, go to the hospital now. We need medical attention. Right? We need to make sure that your oxygen saturation is normal. If minimum, then we give you oxygen. But you need to make sure that also for your stage when I am developing the shortness of breath, I'm seeking medical care. Now, zinto efuna ngenazo ke ngoku. Sanitizer, you have your masks, you have your gloves, but you need to use them in an appropriate manner. Because mask, but it's moving in a very, very wrong way. Remember, only mask, you are protecting your mouth, you are protecting your nose. I'm going to put on some mask now. You're going to say how to use them. And also using your gloves. On and off, you're not going to use the same pair of gloves the whole day, especially when you're taking care of the patient. You put on that one pair of gloves, you use them, you discard, and then you use another one. But let me show you when I mask, let's say, apart from the surgical mask, the blue one, you can see the mask folds. Can you see? In a folds mask, in a color, in a plate, a bendal. This side is going to be over your nostril, and then the other side is going to be over your chin. When you put it on, you put it over your ear and all the way to the other side. But can you see my chin is not covered? After you make sure you extend this please and cover your chin. Right? You press over this so that it fits in. And also you take it out, remove behind your ear, and discard. You don't touch the front of your mask because njengoba uzikhavarishile nje uziprotectile yonke i-infection iza up. So xa uyibamba ungcolisa izandla zakho, you need to sanitize after that. We see a lot of people doing this. You're not covering your mouth. You cover your airway, which includes your nose. And also, people are doing that. I lower down my mask. Remember, the exposed areas have the infection, have the virus. Now, you are collecting all that infection and coming and put it back in your mouth. So that is number one. In most they will get reinfected or infected. PPEs and are wrong. Now, the second thing is gloves. I have my gloves up. Okay. And I do everything for this person. Now, gloves, you need to be able to take the gloves out or off in a right way. So how do we do that? One hand, laying on the glove, hold in the middle or just towards your wrist and pull it off like that. Then just clean glove. Now coming to this one, you hide your fingers underneath and take it out. So you never touch the outside of your glove with your hands again, because the logos will spread this virus. Then you discard. I hope you're going to
yes,
and yes. Demonstration there makes sense. Then the sanitizers. Forget the brand. Okay. Hand sanitizer. Sisebenzisa izandla zobamba lebhotile. Ebanjwe ezaba nevirus yona kuqala. So instead of holding your bottle like that, you rather use your hand or your elbow to dispense. So if you can have it somewhere, I'm just going to change my camera. So if you have it on your table, just use your hand to dispense. So there are many things that you can do to prevent the spread. But negative, positive, sorry. Negative, but taking care of our own people at home. It is so painful to die alone, especially when uzazibana awuphilanga. But so we need to find a coping mechanism and assist that. Hi. Yes. Hi. Yes. Okay. Sorry. Yes, the second.
Okay. Now.
So hi.
Yeah, you can continue. I think
I'm
losing you.
Okay. Now, that I want to emphasize the most, the warning signs. Because and most people, they do recover. But just watch out for those warning signs. As subtle as they may, shortness of breath, please go to hospital. So it was all we need to make sure that the oxygen levels, they are fine, your situation is fine, and your lungs are fine. Go to hospital. Hello.
Yes, Doc. I think in network, yeah.
Okay, sorry.
Now, you spoke about oxygen levels, ne?
Yes.
And also with I think also it's one of the things now that I experienced the time being suspended, whereby they always make sure good oxygen levels are right. because everything starts so abantu lately I know we are not discussing, and we are not going to discuss spaces back and we're not discussing that whether there is space or not, but we are discussing into any shortness of breath is an indication for you to go to hospital. You will need to be attended in hospital
and seek for medical help.
And seek medical help. And you mentioned something very important that I think ukuthi umhlonyane akakwazi ukuyenza, igamtria ayikwazi ukuyenza, eucalyptus oil lesisebenza akwazi ukuyenza. You talked about embolus. Can you just maybe unpack embolus for us so that bayazi abantu abangaba now uthi embolus you might be presenting with embolus. You also mentioned pneumonia and others, but let's just dwell more on the embolus because from my limited knowledge, I think things like imihlonyane siyasebenzisa siyafutha might not be able to help.
Yes. All right. Pulmonary embolus, I'm going to break it down into a simple term. Pulmonary embolus, clot ethi xa isukile ndawo iyohlala emiphungeni kwii-vessels zakho semiphungeni. Ii-lungs zakho consist of the airways and it consists of the blood circulation. So the airways that we call alveolar, which is the end product, yile izawuthatha umoya or oxygenated from the outside, gas exchange with the blood circulation, right? Now, if there's any clot that came from the circulation, over the blood vessels that are within your lungs, then we call that a pulmonary embolus. The problem here is that it presents the similar as pneumonia, the shortness of breath. But now we are dealing with clots. Ezingazuncedwa liyeza lokhohlela. It's a medical emergency. Ona ifuna ube kanti ujongwe kugqirha, wenziwa i-CT scan, wafumana ii-injections ezi-relevant to make sure ubana eza clots zakho nazo ziyadissolve.
Okay. Now, Siabulela Doc, I think we start to say, because I see quite a number of abantu, maybe the city, Mihlonyane will be able to assist with this, whereas I think you need to go to hospital. Now, you spoke about patient that is actually inside the room that abantu are looking after you. And you spoke about mental strength, you spoke about the psychological effect, and all these other things. And you also said it is also advisable at least at times, but cautiously and very cautiously so, making sure and maybe avoiding to contaminate this into Now, I've seen social media doctors who are actually prescribing a one-size-fits-all approach in terms of like now I came up with pneumonia in my own case, Now, when everyone is CT, he tested positive, but at the moment I think the signs and symptoms. Or I've got this headache, over the city, you know what? Take this. Is the COVID-19 a waiting game? Wait up until it presents itself. Galonto is that presenter or can you just gobble everything that the social media doctors are giving to you?
It cannot be a waiting game. Awukwazi ulinda kude kufike i-symptoms. But into yenzayo should be within the expected norm. Now, as I mentioned earlier, that you can have your vitamin C, you can have your vitamin D, you can have your zinc because they support your immune system. everything else is going to be symptomatic.
Okay.
So as in it will develop, tight chest, then we give you something for tight chest, but have something that's going to boost your immune system. Nezo that you're using out there that are causing other problems like kidney failure because you're using concentration not that as a but the concentration and it's untested. Even a herbal intoxication. So consulting and consult with your doctor, consult with your GP as a advisor. I know there's this going around saying get Disprin. Disprin cannot be an umbrella for everyone. There are problems now about studying Disprin, for instance. So consult with your doctor before you take all those things. Yes, it's in a role, but it's our now as an individual. So most of the things that we're going to deal with, we are seeing different symptoms like gastric symptoms, the vomitings, and the diarrhea. This is so funny presentations. That's why in city have your baseline, your vitamins, and then the rest of the treatment is going to be symptomatic. Like you said, vomiting,
Okay. I've seen get dog abantu out there. And also you spoke about it spring. Can we umuntu is coming up with headache, but akazazi into bangaba une problem ne spring and everything. So you've suggested to make sure you consult. Don't just use it Disprin.
Yes.
Maybe what is the function of yenzandole paracetamol, yenzandole Disprin for COVID patient yakho and COVID. Uyinika prescribe mhlawumbe nxa kutheni as a looking after this person.
Okay. Remember Disprin yakho
okanye le paracetamol.
Okay. Remember, COVID will have fever, will have pain. Panadol will deal, which is the paracetamol. Fever, pain. Same as the Disprin, but Disprin go this year in an additional effect, antithrombus, anticoagulation. So Disprin is going to thin your blood. Is our effect here pain? Is our effect which is fever? But is our dissolve and clots in the now, not everyone can take that. It's because only has everything already. Only time is already on Disprin. Remember, I want to pressure the aspirin. Only is already on aspirin, and they're taking extra because they put to eat Disprin. We are overdose, and that is going to cause bleeding, immunopeptic ulcer, and they're taking all those things. So if it's our consult with our history, I will be able to say, don't take that one. Don't take that one. Yeah, the next thing we're seeing people are upper GI bleeding. Abantu overdose Disprin or aspirin. In a role, but cautiously so.
I think into and Pumanayo, it is always advisable that a consultant of the that one is very advisable. And also the fact that needs to make sure that consultant not the on a history, you know. So for I'm trying to think of patient doctor privacy. Akayazi yena uvile into bangabi Disprin iyansika iyayithina iblood inqandele clot iphindile nepain yona rather than ipanado and everything. I'm trying to think ngokuba mhlawumbi nanku lo yagula apha endlini and then with that as the ethics zethu ke zaba health zoba ngaba patient doctor nansika can maybe this particular individual, now that the patient is still at home, can that either that person okanye lo muntu uleli apha can consult yena ngokwakhe while elapha okanye uyakwazi lo uhleli kunye naye ufonela ugqirha wakhe ba ulapha ngoku ndimkhathalele ndingenza njani uthi unenhloko okanye uthi uvingathi kukho into lapha, all those things ndithini, can that particular individual consult okanye ufuna lo muntu bengumuntu othetha nogqirha?
No. Mamela kaloku uyabona, this is a case of emergency. Yonke le scenario ye-COVID is a case of emergency, and akululanga uvele uphakame uhambe kwagqirha. We give our numbers, emergency numbers, off to all people, and I don't think a primary doctor who does not give off their numbers. So it's easier to call whether we primary caregiver or the patient himself was uthetha. All utsho bana ipatient yakho engubani, ipatient yakho engumlambi, into ethile. Ndiyamazi mosona umlambi, ndiyayazi history yakhe. It doesn't mean I'm going to divulge information kamlambi no A, B, C, and D to this patient. But because I know your history, and I can advise, but don't give you I'm not breaching confidentiality up because I'm doing a diagnosis, but because I know you as my private patient, then I can prescribe and advise the primary caregiver what to give you and what not to do. So it is important to have the emergency number at hand at all times.
Okay. Now, tell me, Doc, situation ke ngoku apho khona sayazi into ba umsekelo mna benomalume besithi sistering ngasembizi uyabo kwaba ke ngoku azange bambona ugqirha ngaphambili ne abakhona abantu banjalo kuba zange bambona ugqirha akho medical history yakhe naphi na uyabo now akho nto lo muntu akaziwa and awuyazi noba ndimnike discipline ndingamniki because when you are not medically trained we are new now. Do you think it is advisable also in those cases to also call the doctor and say, you know what, this person, there's no medical history. The only thing we are never, but this person maybe is presenting with these symptoms and that and that and that. So this case also can be able to, the doctor can be able to advise.
Yes. Yes, we can advise. That's what we call a teleconsultation. The face of medicine is changing these days. We are dealing with more telemedicine and more telehealth, relying on the symptoms that you're giving us. Because is that at this time, you know when to refer. No matter but the symptoms you're giving me, I know this is the go and come to the practice, or go to the local clinic, or go to the local hospital. But the fact remains that you have a medical advice. You have a medical advice. That is the most important thing.
Okay.
Now, and the history and now history, but you have consultant and we have directions. So
okay. Okay. Now that you're let's start. And then we'll continue. Asking, is it possible that one can have COVID-19 and recover without any medication or being admitted into hospital?
Okay. Yes. Yes, it is possible. Your immune system can fight for you. Possible to recover. It is possible to recover. For instance, COVID. Oh, you can recover treatment. But what is important is that we need to make sure that the immune system is strong enough. And we've seen a lot of cases where people are fit and they have strong immune system, but they do get symptoms. We all deal with pressure and infections in different ways. So if you do have infection and you symptoms, that's all and good. But there are people that are going to have symptoms. So can you actually have COVID and survive the period until you become negative? With symptoms, with treatment.
I think the talk you mentioned also something there. In the Bangaba, who mentioned something about like level 80. You might recover without having to go to hospital. However, your other question there was about the medication. Medication. I think the best earlier on is ZP is that I'm coming to because part of the question yakhe without any medication, can he just recover?
Okay. Remember, let's say medication. Medication. We have the vitamins that supportive treatment. Then we have symptomatic treatment. Vitamins are called vitamin C. Vitamin C, 1 gram you mean. You need your vitamin D3, you need your zinc. Those 3 as a supplement. You have them. Ezinye that are going to be additional. Symptoms. Now, without any medication, there are people who are not on any medication, not on any supplements, which is also not advisable because you need to boost your immune system. Just keep your vitamins, have your multivitamins. So abanye will need those multivitamins kuphela bangaze symptoms. They won't need Panadol, they won't need anything to dissolve clots, they need any antibiotics to clear out the infection because they don't have. But multivitamins even boosters they are there to support.
Thank you, Doc. Let's go to Anita. Anita, can you suddenly have shortness of breath without any other symptoms? Sometimes I get scared because I don't know if it's anxiety or what.
Okay. I love that question, Yela, anxiety. Shortness of breath, pneumonia, pulmonary embolus. Pneumonia, these are viral infections to progress, but I kid you not. Pulmonary embolus, it's a sudden thing. It is a sudden shortness of breath, which is than lay progressive because it can shoot to the heart and cause sudden death. So you need to be worried about. But on top of that, the anxiety can also present with the similar symptoms because we are all panicking, we are all anxious, our psychological status is not okay. But still, that you cannot take that for granted. So Anita, you do need to have that checked out. Make sure, exclude anxiety. Make sure we don't have pulmonary embolus, we don't have pneumonia in your case.
I was worried today, Doc. I got a voice note. I got a voice note. I think Nosisi uthetha ngentoba she got COVID-19, but what tested positive, symptoms. There were no symptoms, nothing. And this one time, she just decides to wake up and go to the loo, and all of a sudden, she can't move. She can't do anything.
She can't breathe.
She can't move. She's running short of breath. And I'm like, she's like, yes. Okay, now I'm losing my breath and everything. But what really said to me in this whole thing when I was listening, as much as it's a good thing with Pila and everything, but there was no mentioning of hospital. We are teeny and everything. And while we are talking now, I'm trying to think possibly can it be, although I don't have the patient in front of me, now you don't have the patient in front of you to diagnose whether it was due to pneumonia or due to embolus. But maybe can you just emphasize the importance of really making sure that the shortness of breath betuna masingayideleli. You need, it's always a patient to go to hospital.
Today I had a patient, I'm trying to answer your question. I had a patient who is a COVID survivor. 14 days. On day 19, she developed shortness of breath. And she was fine. She was fine. She was just watching TV. She got up into the room and she could not breathe. So she came to the practice. I'm not worried about infection at this stage, but she had all the signs that I would worry about pulmonary embolus. So I called the consultant that if it's the share referred to, and she told me this. We have readmissions of patients who survived COVID-19 coming back with pulmonary embolism. Same people that survived and were discharged a week or 2 weeks ago, they are coming back with pulmonary embolism. And the only sudden symptom that they have or presenting complaint, shortness of breath. So that embolus, remember, that is going to go and shoot Ivanum Tam. So we cannot re-emphasize that. It's serious. You need to look out after that. If not shortness of breath, seek medical attention. Don't say, yes, because it's still a small clot. Once they're big enough to occlude the lumen vessel, then it's going to be a problem. So don't take that lightly. You have to be on your toes and follow it up. Yes, that is it, but we can prioritize. We know emergencies. So when you come and present it, especially the COVID survivors, I'm going to re-emphasize COVID survivors, shortness of breath, go back to the hospital.
Yeah. If I were to explain this, will I be on the right track in Kambi Teta Nondo or says Lali in City Kuye, Iclot Rani Elifridi, Slambi, Buya, one and out, Kusha, Kanye Wopa Wena, Ukopa Guaco, Kumelantis of Vala, Inati, Okanye Lili Pansela Cat. Now people Bambi la Casi, Obabu Tikanya, Delicata.
Delicata, Fumula Gestanta.
Medical Fumula Gesanda. Now, is that ingapakathi ke ngoku kwii-vessels zakho. So yile embolus okanye le clot sithetha ngayo.
Yes, yiyo le. Ndiyathanda ukwenza lo mzekelo wona mlama. Yabona apha ekhaya esinkini, ubona isinki xa sigcwele indaka ukuyijonga phaa ngaphakathi ipipe le yayo ne. Bona ukho amafutha abana njengoba mhlawumbi izitya nje ukho amafutha apha. Yes. That is something like that. Zip clots, but can you imagine how we kill and we come okay, la mafuta ile one kum. Nje yana na kwenzeka egazini lakho. Because umthambo lo wakho wegazi, mthathe if ilalumen yala sink. Eza clots zihleli phaya, kuba nokuba umdaka buphaya wenziwa ngamafutha. Now, the problem is that imithambo yakho yemiphunga nemithambo yakho yenhliziyo miningi kakhulu to accommodate ocinga uba incinci wena. Ilena yathi xa siyibiza yi-shooting ambulance because isuka kumthambo omkhulu ishuthe all the way to emiphungeni okanye enhliziyweni ifike ivale imithambo. So umuntu oqhela igusha oqhela uxhela inkukhu obona igazi once libe ngomoya uyalibona nawe liyadibana liphinde libuye lenza amahluli ngawo ke lavala imiphunga.
I'm looking for the question ka-Nansika ka-Aphile beyibuzile Shem. And kudala misile. But while I'm still doing that, let's go back by coughing. Coughing with me, it took a bit of time. And I presented with bilateral pneumonia, which is double pneumonia. Now, when I presented with them, I was still coughing, and I was still coughing, but the only thing in pulmonary special was the paracetamol. And what could be the reason? But irritated out there. To 14 days, 10 days, and I'm still coughing. What could be the reasons or different potential reasons for that?
Okay. Uzikhumbule ke ubana pneumonia diagnosis. So when I was at home with coughing and shortness of breath and I do all the examination and the France double pneumonia. Pneumonia was the infection, where the gaseous exchange is supposed to occur. Now, la infection eventually will dissolve by antibiotic. and it will become a flame. Le uzayikhohlela ke ngoku and ube ne-sputum. So the more it dissolve, iclearisha imiphunga yakho, la flame isuka, the more uzawukhohlela, which is a good thing because ifuna iphume and it. But ke ngoku awuzudissolve wena iphele within 5 days. There's no duration, but 5 days, 7 days, 4 days. Until you are completely clean, uzawukhohlela. Abanye abantu babe ne-dry cough, which is the irritation of the upper airway. Ayiyo irritation ngoku lower airway, because lower airway yakho yilapha emiphungeni. Yona it's the irritation of the upper airway. Uzawufika umuntu wathi ayikho infection. It doesn't mean it's infectious, but it means that it's a healing process. Izawuphela eventually. You take your duration antibiotics zakho, be it 5 days or 7 days, depending on what antibiotics the doctor give you. Uphela kwazo, i-infection is supposed to clear out, but then the residual symptoms, ezizokhohlela clearing out your flame, they might still continue, but it does not mean whether you're still infectious.
Okay. Okay, let's go. There's a period upper corner. I'm also taking from personal experience. For 2 weeks, you've lost taste. You've lost
of taste.
I did not realize. I mean, for 2 weeks, I only remember there was a time once in a while whereby I took I did Tati fruit in the faga in a skin that sensela in Donald that sensela and I was a case of I felt, although the taste was not there. We are now can we during that time, if you feel as the one who's looking after this person, can you use other supplements except the ones that you've used in the form of shake? Okanye, would you say stay with
nutritional supplements at this time? Okay. Remember, when you're losing it sense of taste, it does not mean I was good. That's one thing that I always correct from people. Because you have to, not because of kumnandi. Yeah, understand? Now, if you lose your sense of taste, you still absorb nutrients. The loss of sense of taste and the loss of sense of smell, the warning signs that something is not going right. It never endings are being affected or infected by the virus. Remember, so your nerve endings are being affected by that. The report I can't smell, I can't taste. But it doesn't mean you cannot swallow. Abandon an appetite. Appetite, but I also good. But you can blend ukutya. Athi ukutya okublend way. Xa caba ke okufuna utye ngecepha ulungile. Blend fruit yakhe, blend veggies zakhe. Umuntu ezoba ne-nutrition azayifumana, because it is so important in boosting your immune system that you have something to eat.
Yeah, thank you, Tom. Hey, I'm telling you, I even lost quite a lot of weight and but again, now that you are saying it has to come up in Mondwin, Jonga, when just forget about the taste. It has to come from your mind. For the sake of me having to beat this thing, this monster, I need myself this fruit.
You need to feed. Yes, you need to be fit always.
Ulisakazi Mbumbula ma forest. We are at what oxygen level as read on oximeter should someone visit the hospital? Do you advise one to buy a nebulizer?
I love them. Lisakazi, high five. Now, the level of oxygen is nothing less than 93%. So when I'm doing blessed enough to have your pulse oximeter, if now your pulse oximeter to check the oxygen levels then make sure when it's above 93%. That is fine. This is what we call a pulse oximeter. check your oxygen levels zakho ngale. Now, i-nebulizer siyisebenzisa for abantu abane-asthma who have bronchoconstriction. Uvaleke ipipe ezizithumela umoya emiphungeni yakho. Remember, you breathe in through your nose, goes down your nasopharynx, it goes down your throat into the airways. Then into your lungs, sorry, get bronchus. Then it miphunga yakho. Now, i-bronchospasm uzokuvaleke pipe abathumela umoya to your lungs. I-pneumonia uzokuvaleke i-lungs ezizayo, not pipe. Now, i-problem ke unosebenzisa i-nebulizer emntwini one-shortness of breath secondary to pneumonia umvala wesi. Because kaloku we are pushing in i-bronchodilators and all we need ukuvuleka kwemiphunga, not okwe-airway, okwe-pipe. And i-nebulizers ozazithenga wena over the counter, they are not oxygen based.
Okay.
They are directed to oxygen. Even if you are short of oxygen, if you nebulizer, you're still getting oxygen. But ekhaya eluyithengile kosembaleni and liberation i-bronchodilators. So no, I don't advise bantwana ukuthi bronchodilators ungayazi lisebenzisela ntoni na. Because shortness of breath can be due to anything. Asthmatic, when they have tight chest, they can feel wheezes. As they become audible, then nebulizer. But shortness of breath associated with pneumonia, with COVID pneumonia, with pulmonary embolus, I use to nebulizer. No. It brings us to a question. This is a question. If negative once better 93, no, we have local clinic, you need a boost of oxygen. I'm work for China now. The oxygen tanks of money clinic. So go to your nearest healthcare center, you have money oxygen. Then you'll be able to diagnose the
Yeah, I think what I've experienced in Amjok, Glendway oxygen is that I think now feel especially I was on 93.
Especially.
But I had quite a lot of difficulties in terms of perfume. As a result, I was one of about who required double oxygen. Glendo can go in nebulizer, I now oxygen. Yeah. So then I was on double oxygen. And then later on, they decided, okay, after 4 days, let's take this one out. So the importance also now is that oxygen levels emzimbeni zibalekile and awukho mhlonyane onokunika oxygen. And ayikho i-eucalyptus oil enokunika oxygen. Inye into enokunika
even make a tree
to go
the oxygen. Yes.
Now, Seripeke has been commenting, rather than asking question. Self-isolation also is the best. You will, let's put a disclaimer maybe first. Whoever's comments that is actually saying are not of this particular show or not Dr. Bogolo's one. So I'm just reading the comments of Abantu. So I'm reading now, peace, Seripe. Self-isolation is the best. You will inhale steam 3 to 4 times a day, drink flu medications 4 times a day, wear warm clothes, drink warm tea anytime you want, sleep peaceful at your bedroom. And that's what bedroom with privacy, exercise or stretch anytime. Let do exercise at dog.
That is so true. That is so true for Umdo positive. Remember, Tina, we're talking about how to care for, but Umdo positive, it's important to do that. Exercise, it is important for your health, for your mind health. keep up the psychological effect. When you're taking care of yourself by exercising, by reading, by doing things that are going to stimulate you, it helps you psychologically. So it is important to do something that is going to keep you motivated and to keep your body fit as well. Remember, we are fighting a virus and an enemy that we cannot see. So keep your body fit with the supplements, with the nutrition, with the tablets. Also, your physical body needs to abide with that as well. You need to assist you in carrying this. So the more healthy you are, the better the chances that you have to survive. So exercise does help. It does help a lot.
Okay. Now, regarding exercising your temperature, is there a restriction whereby now study temperature of you go okay in 34 or study temperature of you go to 38? What's the link between temperature and exercise?
Remember, if your body temperature is about 37. But how uhleli nje endaweni epholile izawudropha to 30, 36, 35, it's fine. But how exercise, you're increasing your metabolism, your blood circulation is going to be high. So our temperature exercise is going to be high because your body is moving at a higher rate. So it's speed now you can feel hot, you sweat and all that. So it's our present temperature during that time, but it does not mean we're not going to be a problem. We're seeing a lot of patients that are coming, that cause be positive, but the temperature is normal. So there's no real link. And no words we are worried about that. No. Okay. We expect my because metabolism is high at this point in time.
Okay. No, I'm glad you've explained that because abanye abantu bazawutesta immediately my person will be exercise.
No, let your pulse go back to your resting. No, allow yourself to go to your resting state. Your pulse to go back to your resting pulse. And the temperature right, then you can test. Let's say from my parking area, depends on the office. Yeah, temperature 38.7. But you want to shoot will let it heat all the way from home. Yeah, so just wait, you temperature and then you retest again. Yeah, boy.
Semsebenzini nxa ihita yemoto kuthiwa temperature yakho
so let me wait outside for some time.
Yeah. Okay. Doc, I want before our second parting shot, I want you to maybe just emphasize on this thing because it also links with what we just spoke about, the temperature anxiety. I think most abanye even feel ukuthi they had the COVID. There was a time when I had this thing. Abanye, they are just presenting with signs because of the anxiety. And can you just help us around this thing, the anxiety, so that we can relax? We can relax.
All right. What we call a psychomotor symptoms. Psychomotor symptoms is when you think all the time, eventually manifests in your body as the symptoms. You always worry that I'm going to get sick, and you do get sick, not because your body is suffering, but because your mind believes it. Pseudo pregnancy. You always want to have a child so bad. Your body ends up growing your tummy, believing that your body is pregnant, and calm down. So anxiety can do that because you are so scared that COVID last week we didn't symptoms. I'm sure you that month we didn't symptoms. I'm sure you. That's why we need a sound mind. We need peace and sound mind. Because once you start becoming anxious about all this, then you will eventually present with symptoms. With COVID. And unfortunately, when government is so overwhelmed, E-lab are so overwhelmed, we can't test everyone. Especially with age group 18, where limitations for labs. You understand? Now, we need to keep our mind healthy Because once we become anxious about this, once we start panicking about this, our bodies are going to give up.
Okay, Job. Ulisakazi umpumpula uphinda wakhomenta uthi you man ndiyamthanda uDoc. So uyabulela kakhulu uyini.
Thank you, Sakazi.
Enkosi ugoba nozinga Mtamlambo, great initiative Buti, thanks for sharing such important information. Lisa Kazi Wakhona, thank you so much, Doc. Now I'm Mlamli for this platform, Enkosi. Nombulelo Jacob, hands. So we've got people who are really appreciating the program. Maybe as you're parting short, Doc, maybe if you can just give us just an overview, maybe okay, guys. Now, in short, you are looking after your brother, your loved ones, your spouse, everyone at home. Please note again the following. Then we part ways.
Okay, thanks, Mary. But before I go there, I need to emphasize on something that is very important that we did not mention, and it is so dangerous. Diabetes. Diabetes and COVID. They seriously don't like each other. Now we are a population where we have a metabolic disorder. Remember, diabetes is a disease of metabolism. Guys, it's going to emphasize, have your checkup done. Go to see your doctor. There is nothing as terrible as undiagnosed diabetes and COVID, because it's difficult to bring that person back. Now, all are diabetic, I got treatment. But why I get treatment? Because I'm not for treatment. Or treatment yakhona is suboptimal. Usehleli neswekile ezingo-21 ekhaya amazima 18. And uyazitshekisha but ufuna ukutya treatment. So diabetes, please, it's the #1 list of the comorbidities that when associated with COVID, they have poor outcome and high fatalities. So I would love to plead with this community that we are with today. Go, even if I'm not symptoms, just go to your nearest doctor, go to your nearest clinic, have your diabetes checked. Not only that, as I'm sorry, I'm 6.1, but have your blood checked out. But even now for the past 3 months. Because the problem is over the past 3 months, if you tell us whether it was high, then we know we're missing the episodes where your sugar was high, so you are an undiagnosed diabetes. We get to a situation where we see people about newly diagnosed COVID, but then it's shoot up, or about high, or 33, and you don't know the relation. But all we know is that at this point in time, someone about poorly controlled diabetes, undiagnosed diabetes, they hardly survive. So I'm pleading with you once again, go and have your diabetes checked out. Not only the pre, but the 3 months one. So in parting,
kesiphendule uxola qala nalombuzo wakhe ne andifundisa umhle ngaphandle uthi uxola am 34 weeks pregnant ne I was in contact with the person who tested positive for COVID-19, but when I went for testing I tested negative. Which medication can I take to protect myself and my unborn baby?
Okay. All right. In pregnancy is very tricky because there are things you cannot take when you're pregnant. Ikakhulu in pregnancy is to watch out for symptoms. No mhlonyane, no gum tree, because mlamli a kid, we are seeing a lot of cases about food higher in pregnancy about premature deliveries. That is premature delivery. We are trying so much to make sure that we have food and contraction in uterus. At 34 weeks and 32 weeks, it is going for into labor. So, when you're pregnant, this is the key. Have yourself checked out. The Panado, that is the only thing we know, but that's the only time because we can take it into our pregnant. Panado. But once you symptoms, when you're going to be more vigilant, watch out on the symptoms, Local clinic is fine. We know what we're looking for. We have all the protocols out for pregnant maternity cases. So but one thing pregnant that always present with, and my own practice, most of the population is dizziness.
Okay.
So watch out for dizziness if you're pregnant. Then you seek shortness of breath, cough, but it's dizziness. It always, most of the patients that I've seen are pregnant, they presented with that and they tested positive. And within our guidelines, it's one of the things that we have to we look for about who are pregnant. So please just watch out for that one. But this means of vitamin C, but no vitamin, we can't take that in higher doses.
Hey, it's a day, Doc. You are coming with something that I didn't even think in terms of your pregnancy. This Lendo Yoba Abando going to premature labor because of all these
yes.
This is very serious. And
it is very
Abando who are pregnant can take it with the seriousness that it comes with. And also we can be cautious as Abando who are pregnant and be also be considered ngabantu abahleli kunye nathi so that we don't actually bring le nansika in 9 months. It's a long time. 9 months it's a long time, and we have this coronavirus.
It's a long time to lose the baby.
Exactly. We don't know what is izawuphela nini na. Thank you for that. Nami ngivule amehlo, and I never thought from that angle. Yabantu aba pregnant, always corona. I always thought of people and forgot about abantu aba pregnant. Now, if someone tested positive and then got healed and you start getting flashbacks, how do you manage the flashbacks? Tell me, flashbacks, madoneze, into 80, including myself. I don't know, Nova, because it's only after COVID. I've got this thing, now, there was we are phoning. Thinking I'm going to call someone and then forget to put your phone in a phone in. But I know yeah. And also, when there are flashbacks, also not only to look at flashbacks only. Let's look at while you are still in hospital. Let me take it further. In hospital, you've got these bad dreams. You've got all these things, and you're in a phase of shutting down or what's happening. So
yes.
What is really happening during after exposure to COVID-19?
I love that question, Zama. I love it so much because I've had so many reports from most of my recovering COVID patients and recovered COVID patients. And one of the things about was the flashbacks. When recollection, remember when they've been exposed to a lot of things. Now, let me say this, Zama. There was one person, two of my patients that mentioned if flashbacks that are almost similar. I'm discharged from the hospital and I'm feeling fine, but after oxygen, that 15 minutes of nobody nebulizer, nobody right. So I don't know whether I'm addicted to oxygen or I'm having flashbacks or I'm having fears. Again, state of mind, state of readiness. Especially when you saw me partner to start number 5. We talk about to 5 and so these things are real, even though we don't have. Remember, research has been conducted and it's still going on. There's no direct link. You want to residual COVID that is remaining in your system can cause a psychological effect. But one thing we know for sure is that unstable mind will cause these things. And remember, the Bible says, I always love this scripture. God says, I have not given you a spirit of fear, of peace and sound mind. So that's spirit of peace and that mind plays a whole positive role in your recovery and in your mental state. Now, that spirit of fear, which we call the spirit, it will cause all this. When I'm traumatized. I remember one patient today said, when I was there, about 4 people would die next to me almost every day when I was there for 10 days. So we went in every day, a civis car, I went to the loop, no, don't come in, somebody died in the loop. So whenever the bathroom, so we need to find a way of coping with it. We need to talk about this. We need to clear our minds. Our research is enough to say this is linking to that, but we just need to be mentally fit. I'm at the stage where no, you can test because I don't know when so I tell them before you test, just take yourself as positive. Because the mind is not there to carry this truth. So we need to prepare ourselves, prepare our minds before our body even prepares ourselves. The facts are always going to be there. Talk about it. Talk to someone. Talk to someone.
I'm glad, Doc. The person whom Pendula is actually doing ministry at the moment. She's a student pastor. So, and I'm sure medical so I'm sure Zama I'm not sure whether you'll be able to comment at the moment or not. I'm talking from experience, even myself. Cool.
There are a lot of theories. As I've said, the research has been conducted. There is nothing concrete as out there. Direct link. I don't want to make assumptions. I don't want to tell you my point of view because this is a medical platform. I will tell you exactly what medical fraternity is saying. At this point in time, there are a lot of research has been done on that one because most people are presenting with it. So I don't want to say yes, I will do it because there's no concrete research that has been done. But yes, it is an after effect.
I hear you. Your parting shot on all on everything that we actually spoke about regarding home-based care. So today we were just about home-based care. We might have to call you again for another show and maybe we'll talk about other things. But at the moment, we would like to just say home-based care. Okay, guys, sorry, we've lost Udok. She's gonna log in again, so just to come in and summarize. So as soon as she comes in, we're going to summarize. All in all, what she was saying, Udok, was that whenever you're looking after a COVID-19 patient, make sure that you also protect yourselves. Protect yourselves how? Make sure you've got an apron. Make sure you've got a mask. Make sure you've got the gloves. She, went as far as showing us, Guti, how you actually dispose your glove, how you take off your mask, how you actually apply even a sanitizer using your elbows or your hand. Now, it is very, very important, guys, to note that umuntu okwi-COVID okanye okwi-isolation or quarantine, makangancwenywa and stigmatized in this room of death. Allow that person some space. He needs to be talking, communicating to you guys. If you've got a spare room with a toilet, yes, you can use the toilet. Toilet. The other things that you can do, allow yena at a certain time to go outside, not outside the house, outside in the yard, but come back for so that adibane nelanga and exercise and do other things, so that we don't experience unnecessary death whereby abantu are dying because but in this bed or in this room of death. So we'd like to thank Doc Ubokolo, Dr. Bokolo. Dr. Bokolo is based in East London, Tanzania, MD Square Highway. So we really want to thank you guys for listening today. I can see Ukuthi Mhlambi, she is not joining in again, but on her behalf, I'd like to thank everyone who took ixesha lakhe to come and listen to this. We'll definitely, if you guys need her to come and sort of come and iron out some few things, we're going to talk to you about some other things. But all we do is home base ekhaya, umgcina njani umuntu who is COVID-19. I'm currently talking to a number of companies so that we can actually try and get reasonable prices in terms of your gloves, in terms of your sanitizers, in terms of your mask and everything, because it looks like everything has gone rocket high. So let's keep watching. Let's keep our eyes sijongile, and something will definitely come up in terms of that. So I'm busy negotiating and see if these companies can give us a certain discount when we're buying, and maybe with a certain code, so that we are able to look after our beloved when we are at home. Guys, let me close it. I want to thank every one of you who actually took time and listened. For the comments and questions, I'll go through them again. For those we'll entertain them some other time. Thank you. Engos.